Modern advances in hemostasis during surgery have significantly improved surgical outcomes by reducing blood loss, minimizing complications, and enhancing patient recovery. Hemostasis refers to the process of stopping bleeding and maintaining a stable blood flow, which is essential during surgery. Recent developments in this field have introduced advanced techniques, technologies, and materials that have transformed how bleeding is managed in surgical settings. Advances in surgical techniques. Minimally invasive surgery, MIS. The use of laparoscopy and robotic surgery has significantly reduced tissue trauma, leading to less bleeding. Small incisions and controlled, precise movements reduce the risk of large blood vessel damage. Endoscopic hemostasis. In gastrointestinal surgery, endoscopic techniques such as argon plasma coagulation, APC, and thermal cautery are used to stop bleeding. These techniques offer precision with minimal damage to surrounding tissue. Suture and stapler devices. Modern suturing techniques, such as tissue sealing sutures and staplers, have been enhanced for better hemostasis. Staplers with built-in thermal or ultrasonic energy are used to ligate blood vessels and tissues while simultaneously preventing bleeding. 2. Hemostatic agents and devices. Topical hemostatic agents. These agents are applied directly to bleeding sites during surgery. They include gelatin-based hemostats. These are absorbable materials that rapidly control bleeding through mechanical tamponade and blood coagulation promotion. Fibrin sealants. These are derived from human plasma proteins and work by promoting clot formation, effectively sealing small vessels and reducing oozing. Chitosan-based agents. These are derived from chitin and work by binding to red blood cells and promoting clot formation. Heparinized and thrombin-impregnated products. Heparin-coated materials reduce clot formation at the site of surgical manipulation, while thrombin-impregnated products accelerate clotting at bleeding sites. 3. Energy-based hemostasis. Electrocautery and diathermy. These technologies use electrical currents to generate heat, sealing blood vessels and tissues by coagulating proteins. Modern electrocautery systems provide more precise control over heat delivery, minimizing thermal damage to surrounding tissues. Ultrasonic and harmonic scalpel. These tools use high-frequency sound waves to coagulate blood vessels. The harmonic scalpel, for example, can simultaneously cut and coagulate tissues, allowing for precise dissection with minimal blood loss. Laser coagulation. Laser technology is used to seal blood vessels and tissues in delicate surgeries, such as ophthalmic, neurological, and vascular surgeries. Lasers can precisely target bleeding vessels, coagulating them without the need for sutures or clamps. 4. Bioactive coatings and surface modifications. Surface-modified materials. Modern advances in material science have led to the development of surgical tools with bioactive coatings that promote faster clotting and reduce infection risks. For instance, tools coated with heparin or other biocompatible materials help control bleeding and prevent thrombosis. Nanotechnology in hemostasis. Nanoparticles are being explored for use in blood clotting by promoting platelet aggregation and enhancing the action of coagulation factors. These advancements hold potential for improving hemostasis in patients with clotting disorders. 5. Blood management and transfusion alternatives. Tranexamic acid, TXA. This antifibrinolytic drug has been shown to reduce blood loss during surgery by inhibiting the breakdown of fibrin, helping to stabilize clots and prevent excessive bleeding. Its use is becoming widespread in surgeries, particularly in orthopedics and cardiovascular procedures. Cell saver technology. In surgeries involving significant blood loss, e.g., cardiac or orthopedic surgery, cell salvage systems are used to collect, process, and reinfuse the patient's own blood, reducing the need for allogenic blood transfusions and minimizing transfusion-related complications. Blood substitutes. Research into synthetic blood products and oxygen carriers has progressed, offering alternatives to traditional blood transfusions. These products aim to maintain adequate oxygen delivery during surgery, especially in patients who are at risk of bleeding complications. 6. Monitoring and predictive technologies. Point-of-care testing. Devices that provide real-time, rapid blood clotting assessments, such as thromboelastography, are used to guide hemostatic therapy during surgery. This helps surgeons assess the patient's coagulation status and tailor interventions to the individual's needs. Intraoperative imaging. Advanced imaging technologies, such as fluorescence-guided surgery and intraoperative ultrasound, allow surgeons to visualize blood vessels in real time, improving their ability to avoid or control bleeding. 7. Robotic surgery and artificial intelligence, AI. Robotic-assisted surgery. Robots equipped with advanced tools, such as the Da Vinci surgical system, provide greater precision and dexterity in surgery, reducing the risk of bleeding during complex procedures. These systems offer better visualization and control, allowing surgeons to ligate blood vessels more effectively. AI in hemostasis. AI-based algorithms are being developed to analyze intraoperative data, helping surgeons predict bleeding risks, optimize hemostatic interventions, and prevent complications. AI is also used in robotic surgery to enhance precision in blood vessel management. 8. Personalized hemostasis management. Genetic and molecular advances. Research into the genetic basis of bleeding disorders has enabled more personalized approaches to hemostasis. For example, some patients with genetic conditions like hemophilia or von Willebrand disease may require specific clotting factor concentrates or medications to manage bleeding risk during surgery. Platelet function monitoring. Personalized platelet function testing allows surgeons to better understand how a patient's platelets behave during surgery, tailoring interventions such as platelet transfusions or the use of specific hemostatic agents to improve clot formation. Conclusion. Modern advances in hemostasis during surgery have drastically improved outcomes, especially by reducing blood loss, improving recovery, and minimizing the need for blood transfusions. Through the development of innovative technologies such as energy-based devices, biologic hemostats, and enhanced monitoring systems, surgeons can better manage bleeding, even in the most complex procedures. These advances, combined with a better understanding of blood management and personalized approaches to coagulation, continue to shape the future of surgery, enhancing patient safety and surgical success.